today, now we are in the era of precision medicine. Precision medicine is precisely tailoring the treatment to a particular age group. For example, a senior citizen who has got a lot of not just diabetes but heart disease and is staying alone may be treated differently in terms of their risk as compared to a non-senior citizen. By what I mean is that in a senior citizen, maybe a very elderly person above the age of 65, the guidelines say that the HbA1c, HbA1c is a single test which gives the blood glucose control of the last 3 months. That should be kept below 7 or even up to 7.5 is okay. Why is that? That's because the moment you are over aggressive in a senior citizen and try to bring down the blood sugar levels to very, very low normal ranges, there may be a risk of a problem called hypoglycemia. Hypoglycemia is low blood sugar, sugar going below normal. That can lead to fainting, sweating, palpitations, trembling, all sorts of symptoms in elderly people. So, and also such low sugars can even trigger a cardiac event also. So, because of these worries, in an elderly patient, I try to be a little conservative, especially if there are other diseases like heart disease or history of stroke. But this is not to say that elderly people should deserve less treatment. No, they deserve a more precise treatment. Yes, we should take all means to make sure that they live a long and healthy life, but we should avoid being over aggressive in treating elderly people with a lot of medicines and with an over aggressive approach, because sometimes these medicines can also interact with each other. What we call the use of multiple pills. One pill can interact with each other. The drug interactions are more common in older people. So these are some of the things a doctor has to take into consideration. And also, I always want to add uh, life to the years of the senior citizen, because it's not enough for me that I get a glucose level under control or a lipid level under control. I want my senior citizen patient to walk well, to enjoy life, to be happy, to have a wholesome life. So I can give an example of one person who came to me. His blood glucose levels were under control and he was following a very, very severe starvation diet. And he had become very thin and very frail. So that's not what I want. I want a healthy person. So a healthy person is important, not somebody who's uh, who's frail and old and starving and trying to control sugar. Yes, the sugar may be under control, but is the skin glowing? Is the person happy? Are you contented? Are you happy with your diet? Is the diet tasty? I think all these things matter, but at the same time, the diet has to be also healthy. So, little bit of advice for senior citizens is our goal is to have an overall health, not just bring down the number of blood sugar, the number of the blood pressure, or the number of cholesterol.